an update on the current situation in BC. A note, there will also be a brief update from Emergency Management BC on last night's earthquake in Alaska. This briefing will be hearing from Rob Schweitzer, Director of Fire Center Operations with the BC Wildfire Service, Peter Brock, Executive of Regional Operations, Emergency Management BC, Catherine Ford, Executive Director of Disaster Risk Reduction with Emergency BC, and finally, Dr. Bonnie Henry, the Provincial Health Officer. We also have Staff Sergeant Janelle Choyette of the BC RCMP if there are questions for her on the line. And a reminder to me line, please press *1 to enter the queue. You will be limited to one question and one follow-up. With that, I'll turn it over to Director of Fire Center Operations with the BC Wildfire Service.
Thank you, and good afternoon, everyone. So the current situation in BC right now from the wildfire is we've seen about 1,250 wildfires since April 1st of this year. That's resulted in nearly 456,000 hectares of area burned. The 10-year at this time is 658 fires and about 106,000 hectares burned. There are currently 245 active fires in BC, and 36 of those are what we consider wildfires of note. Of that 245, 181 of those are due to natural causes. 15 of them are considered to be human caused. This week, the number of daily ignitions have subsided, and the wildfires currently burning has also decreased. It has been a pleasure to welcome additional out-of-province resources over the past. Our partners from other provinces, Mexico, and the Canadian Armed Forces are all actively working on incidents. Our Australian partners are also being assigned or in country and being signed as we speak today. So today and tomorrow will be hot. Severe burning conditions will be seen in the south half of the province. And there'll be overnight burning on these incidents. Then come Saturday and Sunday, we anticipate a bit in the weather. So while this has been a relatively stable week we see some instability in the forecast. So really what that means is we'll see a bit more fresh air in the interior of the south province. And it'll bring, that short-lived increase in fire growth. Visibility is a welcome shift for our aviation teams who have been significantly hampered in their ability to conduct operations. However, we also anticipate some lightning and are monitoring this closely for new fire starts. The incoming system will have some rain, and this change continues into next week with overall cooler temperatures in the southern interior. Regions are in drought condition, so the amount of rain we receive will be very important. So anticipation of the lightning for the BC Wildfire Service is maintaining initial attack preparedness. And what we call initial attack is the first response to a combination of very mobile 3-person crews in conjunction with our aviation resources. Prioritizing initial attack has been a pivotal tactic across the entire season. And given the fuel conditions and the high temperatures we've experienced in the central and southern interior, as well as the southeast part of the province, fire growth with these new starts have been very aggressive. And poor visibility due to smoke has significantly impacted our aviation operations this previous week. So clearer skies are welcome. So I've just shared with you what the BC Wildfire Service is doing in preparation for this weekend. And I often get, what can I do as a member of the public? So we are urging travelers and residents to be extremely cautious over this BC day. People intending to travel anywhere in the province should first check for road closures, evacuation alerts, orders, and other prohibitions, such as rec sites that might be closed or BC parks closures. Not travel to any areas that are subject to evacuation alerts or orders. So all the rating, that's the risk of a wildfire starting, is currently low or very low in some parts of the province, mostly in the north half. People must still exercise extreme caution to ensure their activities do not spark a new wildfire. Many of the BC's forests and grassland remain dry due to unprecedented heat and little rain early in the fire season. All BC wildfire resources are permitted, and with lightning in the forecast, not afford any human-caused fires this weekend. So please be responsible and support our teams to be successful. I'll turn it back over to you, Tara.
Thank you, Rob. Our next speaker is Peter Brock, Executive Director of Regional Operations for Emergency BC.
Good afternoon. I'm going to provide a provincial overview on evacuation orders and alerts. And
I believe you're on.
Can you hear me now?
You're good. My apologies.
Yeah, no problem. So good afternoon. I'm going to provide a provincial overview on evacuation orders and alerts, some other key information. Currently in British Columbia, due to the wildfires, we have 8 states of local emergency, 8 band council resolutions, 62 evacuation that represent approximately 3,443 properties on order. We have 87 evacuation alerts, represents approximately 17,679 properties on alert. There are currently 19 reception centers supporting. That includes 9 in central BC, 4 in northeast BC, 3 in southeast BC, 3 in southwest. Over 6,094 evacuees have registered in total. There are 5 group lodging facilities set up. That includes 3 in central BC, 2 in the southwest, for a total of 800 beds. Of those 800 beds, we have 161 persons located in group lodging at this time. The number of group lodging fluctuates due to activation and deactivation and depending on need and the sites. The maximum capacity for group lodging is dependent not only on the number and size of sites, but also on the availability of volunteers and other factors. We have 3 key messages for British Columbians. 1, create a plan so that you can stay with friends and family if you're evacuated. 2, on evacuation order, leave immediately. 3, if placed on evacuation alert, be prepared to leave quickly. And finally, if you've been evacuated community due to wildfires, you should register with emergency support services, whether you need the support or not. Thank you.
Thank you, Peter. For our next update, we will see Emergency Management BC. This time we'll hear from Catherine Ford, Executive Director of Disaster Risk Reduction.
Great, thank you. Good evening, everyone. So I'll provide an overview of the tsunami event in Alaska over the course of the evening. So at about 11:21, the U.S. Geological Society and the National Tsunami Warning Center notified the province that a magnitude 8.2 earthquake was recorded miles southwest of Chignik, Alaska. And this National Tsunami Warning Center, which is also located in Alaska, it's the lead agency for information on earthquakes and the generation of tsunamis along the coast for British Columbia, as well as for North America. The National Tsunami Warning Center advised of tsunami danger was being evaluated for coastal British Columbia, and that we would be provided updated information as it becomes available. And so Emergency Management BC immediately initiated the provincial emergency notification system, which is a text-to-speech, phone, and email notification. And it goes out to government officials, media, as well as local government and emergency managers. So typically we activate the system for tsunami warning, a watch, or an advisory. But because of the size of the event and the proximity of coastal BC, we wanted to ensure our emergency management partners received that information for their preparedness, but also for determination should they wish to activate their emergency plans. And so Emergency Management activated our Provincial Emergency Coordination Center. And so we were monitoring and active on social media throughout the event to support communities in their. And the Alert Ready system was ready to be activated if a tsunami warning had been issued. And I'll just repeat that BC was evacuation status for the duration of the event. At no point was BC under a tsunami watch or warning. And so although there was no threat of a tsunami to BC, this event, it does demonstrate that coast warning systems do work. I'll just remind folks, please do not call 911 for information on the tsunami in BC. Only call 911 is at stake. So it's important that these lines are freed up for those who have immediate need. And in the event of a future tsunami warning, please stay safe and listen to your local officials and head to higher ground.
Thank you. Final speaker, we'll turn it over to Provincial Health Officer, Dr. Bonnie Henry.
Thank you very much, and good afternoon. So we have a lot of things on the agenda today, but I'm going to talk a little bit about the concerns that we have coming up with weather, and that is, we've heard from Rob Schweitzer, will be affecting much of the southern part of the province, the lower mainland and the interior, adding to the concerns that people can have along with the wildfire and smoke that we're already dealing with. And just to remind people that heat can be deadly, and we have seen that earlier on in this season, in the last month. We want to remind people that extreme heat exceeds risks from things like COVID-19 and the smoke risks that can cause irritation for many people. So heat builds up over the course of a few days, and particularly it can build up indoors. So we're asking people to check on people at higher risk in person to have temperature indoors, or ask people to say what it says on the thermostat. Encourage people who may not know that they are susceptible to baths. Sleep in the coolest part of your room, or if you can, stay with friends who may have cooler housing or have air conditioning. We know that cooling centers are going to be up and will be coordinated by municipalities, and you can sites of your health authority, your municipality, to find where they will be. If people are wearing a mask and have difficulty breathing, remove your mask, whether you're inside or outside, as that can also affect your ability to thermal regulate or regulate your body. We know that anyone can suffer from heat-related illness, but some people are at greater risk, particularly infants and young children rely on adults to monitor their environments and provide enough fluid to drink. People who are underhoused, who have fewer options, avoid prolonged exposure to heat. People 65 years of age and older, or anyone who needs assistance in monitoring their well-being on a regular basis. We also know that people with heart problems or breathing difficulties can also have challenges with heat. The symptoms of heat-related illness can range from mild to severe, and they can creep up on people quickly. Pale, moist skin, heavy sweating, muscle rashing, having a rash, swelling, especially in the feet and hands, fatigue, weakness, and lightheadedness, and vomiting are all signs that you need to seek a cooler environment, and for some people, you may need medical attention. If you are going to be with more symptoms, including things like high fever, very high body temperature, hallucinations, seizures, or losing consciousness, you require urgent medical attention, and you should call 911, move to a cool place, or cool person down with water and fanning. For others, you can call 1 to receive more information you can do to protect yourself from heat, or you can look on the bccdc.ca website. There's a lot of information, and on your local authority website to provide information about how you can cool down, particularly if you don't have access to air conditioning in the next few weeks. Things like using, finding the coolest room in your house, putting an ice tray in front of a fan, using a personal mister, wearing a wet t-shirt, or using a wet sheet at night are all things that can help you stay cool when the temperatures are hot. Also important, opening windows and doors only when the outdoor temperature goes down below the indoor temperature, so at night, and shutting your windows and doors and curtains to keep cooler in and the sun out during the day. Who may not have access to cooler areas themselves. Reminding people, of course, most important, never ever leave children or pets alone in a car in the heat. It can creep up very quickly and it can be lethal. So these are some things that we want people to think about over the next few days as we're expecting the temperatures to increase across the province. And hopefully it will cool off by the end of the weekend. Thank you.
Thank you very much. That concludes the operational updates. A reminder to media on the line, please press *1 to enter the queue. You will be limited to one question and one follow-up. A request as well to media, please take yourselves off speakerphone or Bluetooth if you're asking a question. For the first question, we go to Andrea Wu, Globe and Mail.
Hi there. I have a question for Dr. Henry about COVID and not wildfires. As you know, Alberta is ending most of its COVID-19 measures, which means that there will be no more routine testing, no more contact tracing outside of high-risk settings, no more isolating those who are positive. I'm wondering what your response is to Albertans who want to visit BC this summer, and does BC have the ability to turn away Albertans or do anything to further protect locals in light of this?
So these are some measures that Alberta's announced that are coming into effect later on in the summer. So clearly not right now, and they are very much actively following up people, testing people, as are we. And you know, of course, that yesterday we declared an outbreak in the central Okanagan, the area of British Columbia that is experiencing a lot of issues around heat, wildfires, evacuations. And part of that was reminding people not to travel to those areas unless you are fully vaccinated. So those are the messages that we have for people from Alberta as well. We're happy to have you come fully vaccinated. And when you're here, we expect that everybody takes the measures that we are continuing to take in British Columbia to protect people both from wildfires, fires, from the smoke, and also from COVID-19. We are seeing an increase in cases, not unexpected in most places, but as we mentioned yesterday, we have had a rapid increase in one area of the province, and there are additional measures that are in place in that area to try and prevent transmission. And while we don't expect that we will be turning people away, we do expect that people will take the precautions that we're requiring of everybody once they're in British Columbia.
Andrea, do you have a follow-up?
I do not. I'm good. Thank you.
Thank you. For the next question, we go to Marcella Bernardo, News 1130.
Hi there. I've taken myself off speakerphone, so hopefully you can hear me. Just hoping to ask Dr. Henry also about, you mentioned people who don't have air conditioning in the heat wave. Is this something that the Provincial Health Office is looking into as far as retrofitting older buildings that don't have air conditioning and ensuring that any new buildings do have it? Because I spoke with BC's Chief Coroner, Lisa Lapointe, yesterday, and she indicated that that's something that we need to consider now in the wake of climate change.
Absolutely, and you know, the heat dome that we experienced earlier this summer was really an intensity that we have never ever experienced in this province, and as you know, some of the highest temperatures ever recorded in Canada. We are looking at how we can learn as much as possible, recognizing that with climate change, we are going to have more extreme heat events in the future, and this weekend is no different, although we don't expect it to be nearly as intense as what we experienced in July. So we're working with the BC Centre for Disease Control, Dr. Sarah Henderson, Tom Kozatsky. My colleagues there have been working on heat and the impacts of heat, particularly in urban environments, because we know that there are intensity of heat can build up in what we call urban heat islands. So areas where there's a lot of the built environment, concrete and asphalt roads, for example, that can absorb the heat and keep the temperatures high at night. So there are a number of things that we're looking at. We're looking at mapping out exactly where the excess deaths happened, where people were having challenges with heat illness, heat-related illness. And yes, some of it is related to buildings. Some of it is related to the built environment and being able to increase green space. So air conditioning is part of it. We know there's a lot of buildings in British Columbia, in the Lower Mainland, that do not have air conditioning. As a matter of fact, the majority of buildings in this province don't. And which is different from other parts of the country. So yes, those are all things we're going to be looking at. In the short term, though, I mean, those are longer term issues that we need to think through. In the short term, like this weekend, for the rest of the summer, what we need to do is connect with people. We know from discussions with the coroner's office that a lot of the people who were affected by our latest heat wave were people who lived alone and didn't necessarily recognize the impact that heat was having on them. So we all need to take personal measures to keep cool. Tricks like I mentioned, like wearing a damp shirt, having your sheets damp at night, and having a fan, finding the coolest place in your room, or reaching out to neighbors and friends who may have, or family who may have a cooler place that you can stay. And this is really important for the coming weeks, to check on particularly elderly people, people who are bedridden or have mobility issues, so we can help get through this summer as well. But longer term, we need to look at all of those things.
Marcella, do you have a follow-up?
I do, and this question is, I think, for Rob Schweitzer, if you feel comfortable answering this, and I know you've talked about this before, but how is this heat wave and other heat waves, or just heat in general, impacting the frontline firefighters as they are trying to cope with trying to keep the flames or contain the flames, but also keeping themselves healthy and safe?
Yeah, so I did address this a little bit last week, on the Tuesday call, but it is a challenge. There's no doubt for our crews, and our crews, they're highly fit, highly trained, and really what we need to pay attention to through our support networks and through our first aid is making sure they're getting the rest required, getting the being hydrated, making sure that they are hydrated, and taking many breaks throughout the day. The other thing that we've really focused on internally with our staff is making sure that after their 14-day shift working on the fire line, that they actually get the time off that they need to rest and recuperate. And so we've really paid close attention to that this year, as well as our contractors as well that are help supporting us on the line, as well, and also the support staff that we have working in all of our buildings that support the frontline workers. It is a challenge, there is no doubt, but we want to make sure that because of the length of the season, that they have the ability to stay resilient, healthy throughout the entire season, not just for that 2-week deployment. I did explain some of the tactics and measures that on Tuesday, but it continues to be a challenge, especially with having aerial resources limited due to the visibility. So that really does put a heavier focus on our ground crews and our heavy equipment to do that work. And we are still seeing, and you'll see the information bulletin is really, given the conditions that we're experiencing, we do need to use fire as a tool to reinforce those guards and actually eat up some of that fuel between our guards and the actual fire front to actually steer and control these fires better. So it's a bit of a combination of a number of different tactics, but our number one concern for our people that are on the line is their well-being, is making sure that they're getting the rest that they're needed.
For the next question, we go to Richard Zussman, Global News.
I think this is for Dr. Bonnie Henry as well as emergency services. Around one of the mentions in this call already was about how we have emergency alerts available via text message and other mechanisms for earthquakes. Should we start considering using those for things like heat waves or COVID outbreaks to notify people through text message around concerns related with those type of events?
Yeah, thanks for the question. I think it's a really good point. We really do want to look at all the hazards that we have in BC, and we do monitor those hazards and try to identify what the best use of notification systems are for BC. We know that some of the alert ready technology, as discussed before, is certainly not a replacement of what is currently out there for notifying communities or providing information bulletins. And of course, we really want to make sure we get it right and balance the amount of notifications and really ensure that we don't create let's say public apathy with over notifying. So we know it's important, and we also know it's a priority for us to look at some of these other hazards, as you mentioned, to see how those can fit into new ways of doing business. But for now, our current focus is really to ensure that we're working with communities to provide them what they need, and that's what we're doing right now. Thank you.
I think perhaps I can just add on to that, Richard, in that heat. We've had in health, we've had a committee that's been working on heat and heat alerts for a number of years, but they tend to be regional. So we see local impacts of heat until this past year, where it really was the first time ever that we had it in over the entire province for that period of time. So again, it was another way that was in some ways a wake-up call for us in how climate change is making these things more intense and more widespread. But as I talked about, we tend to get very focal areas where heat can be lethal, particularly in urban areas. So it is very much about having that ground notification, local neighborhoods, and even streets and buildings checking on each other. So we need to do better at trying to mobilize that local support for people who need it. But we're looking at all the ways that we can do that for sure.
Richard, do you have a follow-up?
This is a COVID-related question for Dr. Henry. Dr. Henry, you said earlier this week you're losing patients for those in long-term care who are not vaccinated. What specifically are you going to do about those who are not vaccinated that work in the healthcare system? And is there still any consideration being given to mandatory vaccination for those in the healthcare system?
Yeah, so I've also mentioned that we are working on that and looking at particularly long-term care. I mentioned earlier, I'm putting in place an order that requires reporting of all staff, residents, and volunteers and people who work in long-term care so that public health can verify immunization status. And we'll be putting that in place over the next few weeks. My goal is to make sure that we have all of those opportunities for everybody, not only in long-term care, but in healthcare in general, to receive vaccination. And as you know, we have our big push on for the next couple of weeks. But we need to be prepared for the fall, because it's not going to be only COVID that is our issue. We'll be having, I expect, back to our regular respiratory season, and we have outbreaks of influenza and RSV and other respiratory diseases that cause not only illness but death in long-term care and in healthcare settings as well. So yes, we're in the process of working with HEABC, with the unions, and with healthcare workers themselves to make sure that we have policies in place that that require immunization. And if people are not able to be immunized, that we have other measures in place to ensure that we're doing everything we can to protect those most vulnerable people, particularly in long-term care. And so there will be more information about that. I mentioned that there are other consequences, having to use additional PPE and infection prevention protocols, as well as testing on a regular basis. So we are working through those processes right now.
For the next question, we go to Colton Davies, Radio NL.
Hey there, thanks for doing this. My first question is for the BC Wildfire Service. I'm just curious when it comes to the campfire ban being lifted for the entire northern half of the province as of yesterday. As of today, the fire risk is moderate to high for most of the Prince George and Northwest fire centers. And we've been told how stretched resources are right now for fighting fires. Are you concerned that we might see more human-caused fires in northern BC with this campfire ban lifted and the conditions that we're seeing, which could potentially pull resources off of other fires in our province?
Yeah, so I'm not concerned that we're going to see an increase in human-caused fires. There's a lot of work that goes into our decision makers before coming up with a decision whether or not to put a prohibition in place or to remove it. And so we factor in obviously the weather, the buildup index, which is really the available fuel, on the ground. To create and start a fire, the weather forecast that's for the future, and really look at all those things. And one of the things that we've been challenged with in previous years was not being responsive enough and not using enough science to make those decisions. And so over the past few years, we've utilized this formula to really have science drive our decisions, guide our decisions on when to implement prohibitions or remove them. And so in the case of the Prince George and the Northwest Fire Centers, we were hitting up against those thresholds. We knew the weather was going to change a bit, but we still believe that it's going to take a number of days with a certain weather forecast to actually where we'll hit the threshold of putting a prohibition back into place. And we don't expect that to occur over this weekend. And so we will continue to closely monitor it. And if the forecast doesn't play true for the precipitation that's, scheduled or forecast for that part of the province, then we'll look at it early next week again, and we may have to put prohibitions back in place. We always consider the available resources. We still have initial attack resources available in the north. And we keep them there just for the chance that there may be a human-caused or a lightning-caused fire. So we'll remain those parts of those resources will remain in the north in preparation of that. And again, we'll monitor the weather and the forest fuel conditions to determine if a prohibition needs to come back into place.
Do you have a follow-up, Colton?
And thank you for that explanation. I think my next question is for Dr. Henry, and we've had a blanket of smoke really in Kamloops for almost every day of this month, and I understand that with this weather system of cooler weather that we're expecting, we might get a reprieve on Sunday and Monday or so. But we've been told this week, our newsroom has by Environment Canada, that we could expect smoke for most days for up to 2 more months unless we get some help from the weather conditions. So for people living in these smoky conditions, how do we handle this, and just how hazardous is this heavy smoke, when we're talking about 10+ air quality ratings for things like work?
Yeah, and I've been talking with my colleagues who are up there in Kamloops and Kelowna as well. But yes, wildfire smoke is something that is a type of air pollution that is slightly different than human-caused air pollution from traffic or industry, but it can also be mostly irritating and mostly short-lived. It's hard to believe that short-lived, when we're seeing it for weeks and months, but we know that it can cause, it makes it harder for your lungs to get oxygen into your blood. That is the bottom line. So it can cause irritation to your respiratory system. And we also know it can cause an inflammatory response over time. So that's why it is important for people to take measures to reduce their exposures to smoke. And when it's been smoky skies like what you're experiencing things like wearing a mask if you have to be outdoors is something that can be helpful. Staying inside and balancing the risk of heat, though usually when it's as smoky as it is, that dissipates the heat a little bit, and it is more important to try and be in an area where you have cleaner air. Portable air cleaners that use HEPA filtration can help, and forced air heating, if you have that, can minimize the amount of smoke that comes into your home. But we also need to take those measures about not exercising outside because that can increase the amount of smoky air that gets into our lungs. We don't yet know what this means long term. They are transient exposures, even ones that go on for several weeks, but there's very little research on whether there's longer lasting health effects from from seasonal wildfire smoke. And I know many people would have experienced it a few years ago as well. We are working on that to try and understand that. But the bottom line right now is that the same people that are susceptible to heat are the people that may have conditions exacerbated by smoke as well. And preventing as much exposure to the smoke as you can is really important. And for some people, it may mean that trying to go to another part of the province and staying with family and friends for a period of time might be helpful. It's, you know, I know a number of years ago in 2017, when we had that, the smoke really blanketed the entire province for a long period of time. It was very difficult for people to get away. We're hopeful that as the winds pick up a little bit, that the smoke will dissipate from where it's really been stuck over Kamloops for the last little while. Just taking all the measures that you can to try and find cleaner air is really important.
We have time for one more question, then we go to Brenna Owens, the Canadian Press.
Hi there. Yeah, thank you for taking my question. I think this is probably for provincial officials, but I am curious for the take of the officials on this call. There's a paper out today by a group of UBC forest and wildfire experts and signed by others, including the Mayor of Vernon. It's warning about billions of dollars in increased suppression costs, other indirect costs of fire as the seasons worsen with climate change. And they also cite Health Canada research suggesting hundreds of people could die every year prematurely from smoke exposure. So they're calling for urgent and much bigger landscape scale reduction of fuel in the forest and more engagement with local communities. So does having multiple record-breaking fire seasons, extreme heat and drought in recent years prompt like a more urgent overhaul of how we manage in between fire seasons?
I think so. I should take that one. And I guess first off, I would start with, you know, following the 2017 and 2018 wildfire seasons, there was a strong recent recognition on the work that needs to be done with communities and with reducing the amount of fuel in the forest. This is not something new. This is something that was pointed out in the Filman report back in the early 2000s. And what I would suggest is, you know, following the 17-18 season, we've seen a renewed focus both on funding from the provincial government, as well as engagement from local communities to complete this work in and around their communities for fuel protection. We also continue to work as a ministry with the forest industry in trying to minimize the amount of woody debris left in the forest following timber harvesting. And so it is, there isn't one measure or one option that solves all the problems, because of the fact that we've seen, as you described, a bit with the climate change, and then obviously with the pine beetle epidemic that this province experienced over the last 10 to 15 years. We need to continue to look at how do we manage these unhealthy forests because of the pest and because of what we've seen through the changing weather, on how do we minimize that risk or that exposure with wildfire. You know, I'm part of many different planning tables and discussions within this province and within this ministry on how do we do this better? Like, how do we reintroduce fire back onto the landscape? Fire is a naturally occurring event in many of the ecosystems in the province. So through prescribed fire, through utilization of Indigenous traditional knowledge in use of fire, as well as amending our forest harvesting practices and the woody debris left behind, are all pieces that we continue to discuss and actually start to change policy and implement new strategies to help reduce that amount of fuel that's left behind. Combine that with, as I alluded to earlier, the real desire from both Indigenous and non-Indigenous communities to engage in this work, funded by the provincial government, to actually do a lot more treatments in and around communities. And that could be mechanical treatments, thinning, spacing, and the use of fire to help reduce those fuels, to protect those communities, or help minimize the risk to those communities from a catastrophic wildfire. there's a lot more work to be done. I haven't read that report yet or saw that media article, but it's not the first time that we've seen, experts and scientists tell us that this is something that we need to really pay attention to and adapt our practices. And I know with the BC Wildfire Service and the ministry that we work for, that is something that we take very seriously and have a number of different programs and staff focused on it full time to continue to improve the state of the forest to help minimize this risk to the province in the future.
Brenna, do you have a follow-up?
Yeah, sure. I guess just quickly, I'm interested in kind of the capacity of staff in the off season. So I know there's a big mobilization of crews for the fire season, but does BC and the Wildfire Service and, working with forest industry and other communities need to look at, getting more people involved in these strategies all across the landscape at a scale?
So we do utilize our staff in the shoulder seasons currently to do field mitigation work. And we are engaged in conversations about, is that a workforce that we should look at employing year round to do implement some of these treatments in and around communities. With the funding, we are able to, through our ministry, through UBCM and through local governments, able to provide funding to them to actually employ contractors, the contracting community, and other workers in this field to do this work as well. So it's a bit of a collaboration at times. Either BC Wildfire staff are actually helping deliver on some of that work or helping do the prescriptions for it. But at this point in time, most of it is done through the private contracting community to implement the works. Again, we will continue to look at where we can utilize BC Wildfire staff to do this work. There are a lot of synergies. There's a lot of good results in training for our staff. And again, like I said, we have done this in the past in the shoulder seasons, and I think we will continue to look at, is there efficiencies in actually having staff year round to actually complete this work rather than maybe contracting all of it out to the community. But I think in my mind, in the perfect world, it'll be a combination of both, because there's an employment generation, there's a community engagement perspective to this, and an employment perspective and a learning for our staff as well.
Thank you very much. That concludes today's availability. Have a great afternoon.